This thing is scratch and sniff.
Yeah.
Who is your
Smells like
last
sweat.
guess? Yeah.
My friend Kevin.
Yeah.
He's clean.
He's, yeah,
Fairly
for the most part. Or he said he was, right?
Yeah.
That was part of his
He's
thing.
the one that gave his kids a stink pass.
Yeah, that's right.
Dudes to Dads is a podcast to help men understand and navigate the transition of being a single dude into a family man. How do we make sense of it all? Well, we probably won't be able to, but let's go ahead and have some fun trying. All right, hello everybody. Welcome to the Dudes to Dads podcast. I am Jason Kreidman.
And I'm Alan Bush.
And today we have a guest that is actually a professional.
An actual professional.
An actual professional versus...
Not a professional dad, but he's actually a professional.
Well, he's a professional dad and a professional that actually is a doctor that works in this field that we talk about helping guys, parents, families, men, transition, all of this stuff we talk about.
Yeah.
He actually knows what he's talking about.
He has a degree in this.
Yeah, he has a degree in this. So Dr. Daniel Singley.
Danny, please.
Danny.
And we'll see at the end of the show. We'll see how professional I am. You be the judge.
I think he's going to fit right in.
Yes.
There you go. So we definitely want to talk and get some really good nuggets from the professional standpoint. Want to understand a little bit about your history and sort of, how you came to be into this field. If I understand correctly, because I think we first met, or at least came in contact with each other when I was starting the meetup group, and you were very happy that, wow, there's actually other people doing this, because you had been doing this for 10, 15 years already.
Yeah, I was really excited to see that meetup group.
And I came in a little late to this game. I mean, he's been doing this, practicing this.
Yeah.
And so it was really, really nice though to actually see that, there are other people that were, even from the professional standpoint, of really focusing on the issues that men are dealing with.
Yeah.
So I wanted to just understand, how did you get started? How, you're a psychologist, and, how did you get started? You went to school and then said, okay, yeah, I want to focus on the issues that men are having?
Yeah, I finished grad school right when we were pregnant with my older son. Okay. And at that, grad school in psychology is a fairly reflective kind of endeavor, at least it can be. And so while I was, looking inward and sort of thinking about my own masculinity and fatherhood and my identity, and at that time when we were taking parenting classes, there was just nothing. There was very little in the way of, so I come from a clinical research background. There was very little in the way of solid research on the transition to fatherhood.
Got it.
And there was hardly anything in terms of parenting classes.
It was all for women, or even the books. I mean, the books were for women.
Yeah, largely.
Yeah.
And most of the info was, Dad, you need to support Mom, and there's hardly anything about the kind of support that I knew I was going to need.
Right.
That's very congruent to why you started the meetup group. I mean, it seems.
Well, I was going through my own stuff. I had my second child and was like, oh, maybe I should probably figure this stuff out.
Yeah.
And taking parenting classes and doing that. I wasn't taking it from the clinical standpoint. I was just kind of lost and going, hey, maybe there's other guys that have these same issues.
Yeah. Yeah.
So you were going to school. Did you look at it then from from your own perspective? Was there any thought, looking at it out and saying, there's nothing out here. Wow, that could be a good marketing opportunity or a good business opportunity as well?
It was. I'd like to say I'm that thoughtful and calculated, but like most psychologists, I'm actually a terrible business person. So
I was a psych major in college.
Yeah. So basically, the way it worked out was I found a mentor here in town who himself, he's one of the very few people who does. Name's Dr. Jeff Jones. He's been a fantastic mentor of mine, and
awesome.
he got me started in the dad's class business, and then ultimately I took his over. I applied for a grant, and I got a first 5 grant to sort of seed up the website and the infrastructure for the class.
And so what year was this? Like that you were...
That was 2006.
Okay.
When I got that grant, and it was 2000. It was really 2004 or so when I.
So even 9, 10, 11 years ago, you're saying there just really wasn't anything out there. Still, I mean.
Yeah, I mean, there were people doing some research in the area, but it certainly hadn't trickled down to mainstream psychology practice. Like even now, very, very few psychologists or mental health practitioners broadly would say, yes, I specialize in men's issues. They'll be like, yeah, I treat everybody.
Sure.
Right.
Sure.
It gets baked into everything else.
Right.
Yeah.
And so you started a practice. You said you also were teaching these classes. And I think that's how I also saw that you were, I think it was, we were having our child and I actually saw the classes. You were teaching them at one of the hospitals.
Why didn't you come to the class, man?
Because I thought I knew everything.
Yeah, exactly. I would have cut you free.
See, that was me, like many men. I was like, what do you mean? I don't need no help with this.
Exactly.
I'm perfectly fine.
That's why I market to the moms.
I absolutely. And so that was, I mean, it is, a lot of it was ego. It's just, hey, why would I, in fact, when my wife took the first parenting classes that I've now think are the greatest things in the world, she came home and she's like, hey, this would be great if you, I'm like, I'm not taking a parenting class. Like my parents were great. Like I know how to, that was really the attitude. That was really the attitude, thinking that. And then now looking back, I was like, wow, how could I even have thought that way?
Right.
Because now after, taking classes and reading and even doing this, it's like, there's so much out there to learn that, having an ego just ruins it. It roadblocks you. It just keeps you from, from learning more, having better relationships, all of that. So, so no, definitely. And so, okay, so you were, giving consultations and sort of focusing. Were you still doing obviously you were family practicing or?
No, so I don't actually see kids. That's a specialized kind of training that you get. So I work with the parents. I work with men and women, and I don't actually do straight up family practice.
Okay.
But what I started doing was research. So in addition to the clinical work that I do, I have an ongoing program of research that looks at paternal involvement with children and men's transition to fatherhood. And so all my sort of professional ducks I started really focusing on training opportunities to get more work with men and join some of the professional associations that focus on, like the American Psychological Association has a division devoted to the psychological study of men and masculinity. It's a very small division, but it's also very tight-knit. And so when I meet other people that do men's stuff and fatherhood, you tend to just click and they're very open about.
That was a question I had. Like, did you just jump right into that, or did you start off with like marriage counseling or other types of counseling prior to deciding, hey, men is the area I want to focus on?
I started more as a generalist.
Okay.
And
which most do, I would assume. You kind of find your niche.
As a generalist, but more specializing in anxiety and mood disorders more broadly. But
so you were connecting the mood disorders and the anxiety and stuff to the transition of fatherhood and that connection.
And then another thread of the research that I was really involved in was positive psychology. So in addition to looking at, how do you remediate deficits in problematic areas, you at the same time look at, well, what's going really, really well with you, what's right with you.
Got it.
And then how do we
focus on the
that.
positive?
No, you focus on both. You leverage the positive towards the areas of difficulty, which again, a lot of practitioners, they don't do.
Right. Sort of focused on the negative. How do we fix that?
Yeah, if you're less depressed, then good. And to me, that's not thriving.
Got it.
Right.
That's interesting.
It's
definitely a different perspective. So, one of the topics you'd mentioned was that anxiety, and probably, I'm sure you said depression comes with that too. How do guys typically deal with that? What is the common thing? Because, do they just internalize it? Because that's what seems to be the case.
No, they stuff it or they externalize it.
And how do they externalize it?
So drinking, cheating, gambling, acting out.
Got it. So we're like teenagers.
Yeah, exactly.
We're just glorified teenagers as we go through that process.
Yeah. It's a great business model for me, mind you.
No, that makes total sense. Because women will talk about it. Women will have their friends, their family, and we've kind of touched on this quite a bit. Is the reason for the meetup and everything else. It's like the guys just don't talk about it.
Right.
They don't.
Well, there's the old adage about like if a guy cheats, if, for example, he's just a dog, he's going to cheat anyway, whereas if the women do, there's some sort of psychological reasoning behind it, which is not necessarily true.
Well, what was it that we said? It was when a guy cheats, he's a dog. And when a woman cheats, it's because he's a dog.
Right, exactly. I like that. Sure.
But apparently that's not the case. There's obviously psychological reasons you could probably get to that. There's a reason behind it.
Yeah, I mean, the flip side of the coin of men being externalizers, again, sexist statement number 19 of the day, is
mostly men listening, so it's okay.
Right, we could say, is that women tend to internalize and will sort of sit with and ruminate, whereas your average guy is looking to just stuff it and move on. Yeah. And a lot of times those externalizing behaviors like drinking or cheating or running around or high intensity, call them dopaminergic experiences, that really helps to distract you and do the emotional stuffing.
Right.
Got it.
Yeah.
We've had, in the meetups, we have had some people that have come in suffering from anxiety and depression and sort of doing that. And it's interesting because, I didn't know what to do. I mean, it's great to now be connected to a resource because they were coming in and, we are doing, I wouldn't say we're surface, but in a sense we are. We're talking about sort of advice and things like that. And when somebody's really having that kind of issue, you've got to be a little bit more, careful with it, if you will. Yeah. And so we recommend, that was the recommendation, was like, you need to talk to a professional.
Yeah, if it gets to that point where you're having really things that are interfering with your work or your life,
right,
you need to talk to a professional.
Yeah.
It helps to have meetup groups, definitely.
Yeah, no, I think the meetup maybe even provided a little bit of a motivation to be like, maybe I do need to talk to somebody else, which was the first step of even just coming out and saying, hey, listen, I'm kind of going through some issues, which I think for a guy is a big deal alone.
It's a huge deal. We don't do that very
by the time they even get to you, that's a pretty big step. The idea that they've, reached out, whether it's a call, they were referred, whatever, they've already sort of made that mental jump that like, oh, maybe I do have an issue.
Yeah.
Maybe I need to get some help.
Or they get dragged into it by their partner. That's which
is also, most case. Yeah.
No, it's about 50-50.
I was going to say, how common is it? Yeah. It's half-half?
It's really about 50-50.
Yeah.
Sometimes it's the dad just, he's tried everything and hasn't worked out. And sometimes it's the mom. She feels like they've tried everything or the partner.
Right.
And she'll reach out.
And what would you say? Can you, there's obviously probably so many answers to it and people are so different, but at the same time, all men are the same, Can you put some commonalities together for people who might be listening to sort of understand, how does the anxiety and depression typically come about? I can look at my own process that I went through and I had financial stress.
Yeah.
There's a stress on the relationship.
Yep.
There's the provider, which is a little separate from financial, but just like, I have to make sure that everyone's okay, and sort of keeping it all together. There's time. There's all these issues. I would imagine that's what manifests itself into then the anxiety and depression kind of thing.
Yeah. Yeah. In addition to the financial stuff, the work-life balance, the relationship issues that inevitably, statistically, mom and dad's relationship satisfaction goes down right after the birth of a child, particularly the first child.
Is that on both sides?
On both sides, yeah. Thankfully, there's plenty that you can do to keep that from happening, but a lot of times guys aren't really well socialized to do it. But another really important factor is if you have a history of mental health difficulties. So, for example, if you've had significant anxiety or you've had depression or post-traumatic
pregnancy is
stress,
not going to help it.
Well, it may just cycle you back into it because there's some stress associated with pretty much any kind of adjustment that you're going to make. Yeah. And becoming a parent is an adjustment, and it doesn't have to be an overwhelming or difficult one, but that's one factor.
So it's is it just the fact that it's a major life change? Just that alone. It's interesting. We took a poll. We were going around and everybody, when the meetup group, they had their first child, somewhere within that year, 2, whatever, they had major job change. They bought a house or moved into somewhere and became financial. It was there were so many commonalities of the shift that happens, going from a dude to a dad of all of a sudden, you got to have a bigger place, and so you look at, am I providing enough? Do I need to get a better job or do I make more money?
Well, so it's multiple factors that go into that very robust research finding that relationship satisfaction goes down. It's not just because you have a kid, it's because now you have a mortgage and now you have the job shift and
less time.
All these sorts of things.
Right. So that's cool. We are somewhat correct, and it's backed with actual research.
Yeah, exactly.
That we can produce, say, hey, what we were feeling is actually real.
Right.
I mean,
Yeah.
that's pretty, so that is still an ongoing thing for you of studying that from the clinical side of actually doing the research.
It is, but there's another related point about men experiencing specifically depression. And so the way that my tagline is, I study men's perinatal mental health. So that's the period spanning conception to about a year or so postpartum. Postpartum depression in men, the number one risk factor, the number one strongest predictor is mom's postpartum depression.
Oh, wow.
Even above and beyond, if the dad has had a history of major depressive disorder, mom's experience of postpartum depression is a stronger predictor of him having clinically significant depression in the postpartum period. And it looks different than it does for moms. That's another tricky.
Is it because he's absorbing the energy from her?
It's because the relationship is so
strained?
important, and men are socialized to get the majority. Of course, I'm speaking in heterosexual terms, so I'm talking about male-female couples here.
Yeah.
But men are socialized to try to get the majority of our closeness, the majority of our emotional intimacy needs met in our primary romantic relationship.
Right.
And if, as that relationship satisfaction starts taking a hit, he's having problems.
I mean, you're not having sex as much, you're not connecting as much, you're not talking, whatever it is. You're not spending enough time together, whatever your love language is.
Exactly.
You're not doing that. And that's definitely, I could see that.
So a lot of times people say, well, aren't you just blaming the mom for him getting depressed? No, I'm pointing to how crucially
how we deal with it.
Well, how important the relationship is.
Yeah,
and that's why you don't just deal with the postpartum dad in a vacuum. You've got to look at the relationship and the family system.
So then you start talking.
It's a unit.
Exactly.
Yeah.
So you start, this is going pretty broad, but you start talking about date nights and you start talking about spending time together. I mean, are those the kinds of things that you deal with and start talking about?
It depends on what they have going on, but largely it's communicating proactively, how to have productive conflict, how to make sure that you're creating meaning and having more connection, fun in the relationship.
Outside of
how do you fight fair and how do you have more fun, basically?
Wow. Should have met him a long time ago. Could have been so valuable.
Yeah, right.
Doing okay, but it's just,
is 2020.
I know. This is information. It's funny because it's so valuable to get this information, but it's amazing how few of us seek it out.
Yeah.
Because we really don't know where to get it, how to get it. And I think that's the purpose of what we're trying to do is can we provide some information that is typically not found anywhere, like one of the things that was interesting, like even on our podcast, we have all these tips and advice and all this stuff. Our number one downloaded podcast is the divorce segment.
Right.
And I think because there's not a lot of information out there, like how do you deal with divorce? And so in the same vein, this may be more focused on, let's say, the anxiety and depression. It's like, how do you deal with that? And is a guy going out and looking on Amazon and going, how should I deal with this anxiety and depression about my baby? Right. I don't know. There's seekers and there's non-seekers.
Believe me, they Google it.
They are. They're Googling it, but are they willing to pay for it?
Yeah.
You're right. But that's why you have your wife.
Thankfully, yes, they are.
Yeah, right.
Well, but I guess the percentages of people, you imagine, that you're seeing the people who are actually proactively looking for it. That's where I'm getting. It's like, I know, I could probably go through my friends list and know a huge amount that had probably dealt with a lot of issues during that time, and what I have seen or didn't really do much about it.
Right.
You just kind of grind through it and hope that you hold on.
There's an awesome research factoid on this, which is that the average amount of time that a person who's told that they have a cardiac problem, the average amount of time that goes between when they find that out and they make an appointment to go be seen by a specialist is 6 days. The average amount of time that passes between when one or both of the partners in a relationship feels like something's not going well here, and when they make that first appointment, if they make it, 6 years.
Oh, wow.
So couples counseling gets kind of a bad rap, A, because there are some not so good couples counselors out there, but B, because a lot
everyone
of times
does it too late.
When couples get there, there's either been so much damage done or there's so much of a divide there that the people have to be really motivated.
Wow.
Yeah.
That is an incredible statistic.
Yeah, that's what, like, wow, that's like exponentially larger than what you would expect.
Luckily, I like a challenge.
Yeah, right.
Yeah, I mean, so
you get paid by the hour, so it's like,
well, so I mean, that makes sense. I mean, you're including the whole family. Obviously, the issues that you face when you're having a child, there's so much more involved. Like you said, I mean, it's the wife or the significant other or whatever. Along with, I'm sure there's extended family. There's all kinds of stuff that you have to deal with. And we've touched on a couple of those things. What are some things, I mean, when somebody is dealing with this kind of things, do you give tips or things that maybe for the listeners that, things that they may be able to do, short of seeking help out?
Yeah.
But,
Well, first is just to be aware that men will oftentimes experience their own mental health issues differently than a sort of stereotypical feminized way. For example, with depression, a lot of times men, rather than get, weepy and, sort of crying in the corner and like this sort of thing, the term is masked male depression. And so your average guy who's having this kind of sort of male-centric depression looks angry, he looks withdrawn, and he looks pissed off. Basically. And so and it can be very confusing to him because what feels like irritation and frustration and just sort of pulling back from people because he's thinking negatively about himself or trying to, use some substances and take the edge off a bit, that guy's depressed, but he's not
he doesn't know that.
No, nor typically do the people that are closest to him.
So I guess, yeah.
So that's recognition in answer to your question.
Yeah,
One is just knowing that.
So some way to identify that, I guess, on a higher level, do they know, well, wow, maybe I'm drinking too much because something's wrong,
Right.
Or are they not even thinking on that level?
May or may not. But so related to those points, there are pretty specific things that you can do. If for example, if it's depression or a lot of anxiety, make sure that dads, that you're getting social support from somebody other than your partner. It's not fair, it's not reasonable to assume that she or he is going to be able to meet all of your social support needs.
Right.
But that's what we're socialized to think. We can only be vulnerable, So
does that mean going out with the guys? I mean, what does that mean?
Yeah, it can mean golf, it can mean coffee, it can mean a phone call to your brother-in-law.
Got it.
It doesn't really matter.
Just some kind of social outlet.
And doing it proactively, not letting that fall off the radar.
Right.
That's one. And another thing related to the relationship satisfaction thing is I always counsel couples. I always tell couples to do what I call the weekly State of the Union meeting, which is the two of them sit down and just check in with each other. How you doing? Here's what's going well for me. Here's what's a problem for me. Here's what about you? But it's not a nag fest. It's not, here's what I want you to do. You don't do the family logistics. It's just, I want you to know how I'm doing, the good, the bad, and the ugly. And if you do that proactively instead of reactively, I just hit over 1,000 dads that have gone through my class. And the ones that...
Which class?
The basic training.
The basic
for new
training.
dads.
Okay, cool.
And that's the thing.
I know you have a couple of classes. So
yeah. But that's the one where they tend to come back and say, Doc, it was the State of the Union thing that was a game changer.
Wow. Well, one of the things too, I mean, you're here in San Diego. Do you practice nationally? I mean, can people call in? And
They can. So this is another. So I work with an outfit called the Postpartum Support International.
Okay.
And they have a website. I'll butcher it if I try to say it here, but Google Postpartum Support International. But for example, somebody comes into Dudes to Dads and says, hey, I've actually, I'm really anxious, or it turns out I'm feeling depressed. Direct them to PSI, to their website, and I host a monthly dads call-in.
Oh, okay.
And it's free, and you can just call in and talk
So
about
what is the way people can get a hold of you? I mean, what is the best way for you,
Go through my website, menexcel.com.
Okay, and we'll definitely, we'll put that up on when we post the audio in the episode, so people can get in touch with you if they had questions or they need some assistance or something like that. That'd be great. So what else from the tips standpoint, from the anxiety and depression? So far, those are great. I mean, those are great nuggets.
Yeah.
It's like, one, like you said, the identifying and just kind of understanding that, hey, maybe there's some issue. Mm-hmm. What are some other things that the guys can do to, beyond just recognize it? What are some coping mechanisms that are healthy? You said go talk with friends or go out. Are there other things that people can do? Yeah,
lots of them. There's clinical techniques and tools that I'll work with them on, but one of them that I find to be particularly helpful is for guys to learn how to express emotions other than anger. And when I say anger, I mean frustration, irritation, anger, all of that, pissed off. To me, it's just sort of all on the same axis of emotion there.
Sure.
But what we were saying earlier, guys externalize. It's very easy to externalize anger. But when we look really mad, our partner doesn't understand what's going on for us internally, and frankly, we may not either. But usually anger is a secondary emotion, and there's usually a primary emotion under that that's very difficult. I resent the baby because I don't have you to myself anymore.
Fear, being alone,
anxiety,
and there's all kinds of stuff. Yeah.
Jealousy, and all of this. A really big thing that guys can do is to actually, when they're angry, when they're irritable or frustrated, whatever it is, just pull the mental bus over for a second and really check in and say, okay, I'm angry, I'm frustrated, I'm irritated. What else? And then communicate that.
So like why? Or you're saying what else? Does that mean why? Like what made me do that? Like,
no. I'm also very anxious that this is going to ruin my relationship.
I'm not just mad. I also have this anxiety.
What are those more primary?
Yeah.
And that's the opposite. That's why women tend to be more in touch with those because you have to be internalizing to do that. Whereas we're getting angry and blaming stuff outside of ourselves.
Simply asking that question could be a catalyst to even looking at that. I'm angry. Why? What else are you feeling?
And what else?
Oh, man,
exactly.
I didn't think about that. I'm also frustrated with this. Well, frustrated with what? Oh, well, my baby's doing this. Okay, well,
and maybe, because it's funny, we actually have gotten some emails from women, but, for women listening, because some of the women are listening to like, hey, what are these guys talking about? Yeah. What can the wives or the girlfriends or the significant others do in those kinds of situations? I mean, are you helpless? Are you kind of... No. What can you do without trying to frustrate somebody more?
It kind of depends where they are in the cycle. One of the things that the partners can do, particularly if they're within that first year or so postpartum, is one, work really hard to give dad as much alone time with the baby as soon as possible, because that engenders a sense of confidence in dad, which then can
versus like, hey, listen, you're not breastfeeding, you can't do anything, don't worry about it.
Exactly. in the biz, it's called gatekeeping, maternal gatekeeping.
Totally.
And it happens.
No, the baby likes me. The baby's much more calm when he's with me.
My favorite is the baby wants you to apologize. Like I speak for the baby, and it's like, how come dads never try to do that? The baby wants to go to the green flash.
Baby told me on the side that you're not so cool.
Exactly. But that's one.
That makes sense. That's funny.
I always have, I'm just kind of back to what is the primary stressors that cause these issues? I mean, it's kind of a vague question, but
which we talked about a little bit, the finance.
Like what would you say like the top 3 to 5 stressors are in relationships when you come to this?
It varies hugely, but one is if you have
clinically, I guess, which ones?
If you have a biological predisposition toward a mood or anxiety disorder, that's sort of the substrate upon which the whole
And then you said the women
rests.
having it.
Was that a common thread, like what you've experienced?
Yeah.
Is it okay to me to ask that?
Yeah, of course.
Okay, yeah, because so you're saying that biological predeterminants are one.
They certainly can be, but then there's going to be the actual environmental stressors that would bring them out. Okay. For example, a big life change, like it's not just I become a father, it's I have the role change that involves becoming a father, and then in the relationship, I'm in love with a woman who's also navigating the role change of becoming a mother. So there's a lot of working parts, and it gets confusing and frankly kind of threatening.
It's not an easy road.
No, the financial stuff.
We wouldn't be here if it was.
The lack of sleep. I mean, that's not a small thing that can really kind of wreak havoc with your.
Yeah, you don't take care of yourself. You're like eating whatever you can because you don't have enough time, and then you're. Yeah, I mean, I remember I said, which my wife was so wonderful in taking a lot of that nighttime responsibility on because I was working and she, so it was, I was lucky that way, that I was able to get some sleep, especially with the second child. But I remember even just during the first, those times where I was a zombie. Like, I mean, and it's funny to see other people in your office who are like a little disheveled. They're like, oh, they just had a kid.
Yeah, the new dads are coming in.
He's got baby brain.
Guy in the world. Yeah, he just looks like, hey, how's it going? Like a zombie walking in there. But is financial part of that as well? Or is that like
definitely
hand in hand with that?
Well, think about it. If for guys, we're generally socialized that a big part of what makes us successful is we're a provider, right? We keep the saber tooths away, we have a roof over the head, and then we provide for our families, right?
Yeah.
And what's provision? It's earning. And so we tend to have a lot of that role change is wrapped up in how well am I doing at that very heavily socialized role.
Yeah, and I quit my, I left my job or my role. I was running a company right before my first child. How awesome was that?
Wow. Just blew all the dust off the pipes.
Yeah,
at
it's like,
one
we might as well
time.
make it complete. We should have moved and had a, you know, parents were sick. I mean, it was like, oh yeah, it was just the perfect storm of going through all that.
Yeah.
And you know what was amazing was that my wife was supportive at the time, which I look back, I'm like, how? You know, like
What was she thinking?
well, you know, there was a little bit of obviously uncertainty, but that
Sure.
trust and that support of like, hey, well, you know, you're obviously, hopefully you know what you're doing.
Sure,
You
yeah.
know, and I became a consultant and it was fine, but you know, luckily, but there were some struggles with that. And that was, looking back, I probably could have waited a little longer. But you know, when you're in situations that you're just like, I don't think this is a good situation for me.
Yeah.
You know, you try to make the best. And especially like you said, when you have a child on the way, you start to think completely different than you've ever thought before. You know, you start to look three-dimensional. You're looking within, like, am I doing something of value? There's all kinds of changes. I mean, I went through a lot of that personally of like, am I really adding value in the world? You know, am I gonna be proud of what I'm doing to tell my child? I mean, there's all kinds of things that go through your head when you're in that process.
That's a great example of the thought process related to a role change.
Yeah. Well, that's the thing. I mean, I think because I went through all this, it hit so hard because I did. I mean, this is the impetus of why I'm doing what I'm doing now. It's like that role change was so big. It was such a big deal. You know, some people at least like it appears like it's not that big of a deal, but I think they're full of it.
Well, this is something that I tell patients all the time. It's not fair to judge your interior and compare it to someone's exterior. It's an apples to oranges comparison because they're struggling with their own stuff, and we all engage in impression management, and we don't throw it all out.
Can you repeat that again?
Yeah, it's not fair to compare your interior to somebody else's exterior. It's not a beautiful fair
quote.
comparison.
Yeah.
That really rings true. It's like
But everybody does it.
Oh, absolutely.
And if you're depressed and if you're anxious and you're walking around with all these negative thoughts and it's bugging you and you're telling yourself and nobody else has it, but it's just not the case.
Right.
Yeah.
And nobody knows.
Yeah.
You know, because we don't talk about it. I mean, your family doesn't know, and especially the guy. Oh, no, everything's cool. How's everything going? Oh, awesome. You know, I'm not getting any sleep. I'm, you know, me and my wife are just so romantic all the time. I mean, everything's just wonderful, you know, and it's like, nah, it's not as peachy. You know?
Related to the question you asked, what can the moms do? One of the best things the moms can do is work to keep themselves healthy.
Yeah.
If they're having difficulty, then they can be proactive about it as well. But then also, one piece of that is they go out and get support. It's not just, you know, dad goes out and plays golf or goes surfing or whatever. She needs to do that. And they both need to be proactive about making sure the other one is not isolating and is getting in with other people and that it's happening guilt-free. It doesn't come at a cost where they throw it in each other's face later on. That's huge.
Yeah.
Right. Oh, that's amazing. You know what I want to do? I want to take a short break, and we'll come back in a second.
Okay.
And we'll come back with some final thoughts and kind of wrap this thing up.
Okay, great.
All right?
Deuce and Dads would like to thank Dr. Singley for joining us today. If you would like more information about Dr. Singley and the Center for Men's Excellence, he can be reached at his website, www.menexcel.com. That's MENEXCEL. And on Facebook at facebook.com/menexcel. Thanks again, Dr. Dan.
And we're back. So one of the things, you know, that I was really interested in is understanding, you know, the differences, and we touched on it a little bit, the differences of men and women. I mean, you focused, you know, obviously your practice more on men, hence the Center for Men's Excellence. The name makes total sense. Right. Of really the differences of how men and women deal with this stuff. You know, what are the major differences? You talked, I think we touched on
Depression.
Depression and sort of the differences of that and how that manifests itself.
Yeah, there are also some pretty well verified through research differences in the ways that fathers and mothers tend to interact with their kids, particularly with infants. And one is that men tend to spend a higher percentage of our time in play. So fathers play more with their kids.
Yeah.
Right.
And
Rough
mothers,
houses. A little bit.
And I hesitate to say, rough and tumble, because you don't want to be so rough with
Not
an
with an
infant,
infant,
but more jazzed up, a more sort of
Yeah,
higher intensity play style.
And it's funny that also we had this conversation once about even if the infant is a boy or a girl, the difference just mentally of thinking like, oh, the boy, more rough and tumble and play versus like, why the girl could do the same thing.
They can. Interestingly, there's the research on it is mixed, but sort of the interaction of the gender of the baby and how dads or moms will interact with them. It's what you would think. Dads tend to be a little bit more jazzed up with the little boys. One of the interesting implications is there's a solid body of research which shows that the more heavily involved fathers are with their infants, even with infants, with newborns, that
involved meaning time, touching,
spending time
everything.
playing with them, changing their diapers, cuckooing,
everything.
all of this kind of stuff. The more that fathers are involved with even their infants, that down the road, those kids tend to emotionally regulate better. They have higher IQs. They're more ready for school. They're more socially accepted.
What is it? I mean, what is it?
The actual link of why.
You can't just say we're better.
Yeah, we're just better. No, it goes back to sort of what's different. And one way to look at that is that if you think about it from the baby's perspective, at the level of the child's nervous system, their neuroendocrine system, when the mental images here is the dad's throwing the baby up in the air, gives them a little toss. When that happens, the baby has a little spike in hormones, right? It's a little wee juice,
yeah.
right? And the more
that's a funny picture.
The more the dad does that, stereotypically what happens is the dad throws him up, does that 3 times, and then puts the baby down and walks off and checks his phone for a minute or so, and then comes back and does it all over again. And again, thinking through it at the baby's level, this gets the baby into a highly aroused state, but then by getting put down, the baby's allowed to self-regulate and down-regulate emotionally down to a lower intensity state. Whereas sexist statement number 53 of the day, typically moms with infants have a much more lower intensity and sustained
even keel.
Yeah,
kinda?
so think they've got the little nursing pillow on and it's wheels on the bus go round and round, and it's like this. Whereas, and babies need all of this,
right.
But the idea is that by getting the babies that much more jazzed up and then allowing them to down-regulate, that may be one of the mechanisms through which dads play, more rough and tumble play, allows the babies to have all those neat outcomes I talked about earlier.
Do you remember Scott, in our meetup, said that all the world's problems can be solved by wrestling?
Oh, right.
You remember that?
That's right.
He said, everything with your children can be solved by wrestling.
Yeah.
Understanding your body, the physical touch, like all kinds of stuff. And it was like, that kind of made sense. Now that, now I'm like, wow, he actually knew what he was talking about.
I'm imagining like a wrestling pit at the World Health Organization, Thunderdome.
But it's good for the children.
Right, exactly. We have to
off
do
the top
leg
rope.
drops. Yeah.
No, so that's really interesting. I mean, the idea. So the tip is dads get more involved. I guess they think, well, the baby needs to be fed and needs to do this. And it's like they're benefiting from that mom experience and that bond. I know for me personally, I think I suffered a little bit from that. Is like, I didn't know what to do.
Yeah.
It was kind of like the baby would need to be fed. Okay. She was breastfeeding. Okay. There. I'm kind of missed out on that one. Okay. Maybe I could take a bottle once in a while.
Right.
I didn't mind changing, I'd change, but didn't certainly change as much diapers as my wife. And so it's like, okay, well, what can you do with the baby still? And you're right. It's just holding it, play with it, throw it.
Yeah.
Wait, don't throw the baby. But
Gentle tossing.
Tossing up in the air and catching it is the key, right?
Yeah.
We should use that as a soundbite.
The related question though is moms allow dad to do these things. We talked about gatekeeping a little bit earlier, and different than mom doesn't equal bad. Right. And so this is a dynamic that I see over and over again in
don't throw the baby.
New parents. Don't kick the baby.
Yeah, don't punt the baby over there.
But just so that moms and dads understand, they have different things to offer kids and their different styles are okay.
That's awesome. That's cool. Well, we're closing up here. Is there any final words that you have for the masses out there? We're now internationally, our exposure
we have
being listened to internationally.
at this point. Yeah.
We're definitely going to give the information for Dr. Singley. We'll put it on the website where they can contact him. If you're local in the area in San Diego, definitely, can see you personally. Do you take phone calls? Do things like that?
I will field calls.
Yeah. So if somebody is in a different area, you can.
It's all on the website.
What's your website address again?
It's www.menexcel.
menexcel, menexcel.com.
That's me.
All right.
That's awesome. Well, thank you, Daniel. Danny. I'm sorry. We're still on a Danny term.
Yeah, it's only Daniel when I'm in trouble. It's Daniel. I'm looking around for my mom.
There you go. And to say your last name. But Danny, thank you for putting some great information here. All the tips and information is really valuable. The guys that are, suffering from stuff like this, anxiety and depression, it's very, very valuable to at least recognize it, seek out some help if you need it. There's no shame in that, obviously. And get the help that you need, and that's what we're here for. So
if we have a listener that has some advice that we can't tackle, would we be able to contact you?
Yeah, go straight to the website has a contact me.
Okay, great.
Yeah, let them know you heard it on the podcast.
Yeah, Dudes to Dads.
Yeah.
Dudestodads.com. If you have any questions, email us podcast@dudestodads.com. We're also on iTunes and Stitcher. On iTunes, you can go give us a review. Preferably
Nice one.
5 stars.
5 stars would be nice.
And make sure you hit that subscribe button. And anything else, Alan?
No, I think we're good. That was really helpful. I love the psychological part of it, being that I was
And
a
the
psych
data.
major.
The data is awesome. It's like actual real data. We just talk about
True marketer speaking.
Yeah.
Data.
Yeah.
Data.
Well, no, but a
Analytics
lot of
on
the
all
stuff
this
we talk about here is just, it's kind of like experience and what we think and stuff. But when you actually have some data to back it up.
Yeah, it does help to understand it from the psychological perspective and the actual professional perspective, not just kind of theories, but you have data to back it up. But hearing the psychology part of it made me...
Well, there's no substitute for experience, and I really appreciate you having me on, and I'm a huge fan of what it is that you're doing. It's a fantastic resource that what all three of us could have used.
Yeah. For sure. Well, the big dude over here, he's gonna be so poised and ready to go.
Yeah, I don't have kids yet. So
Oh yeah, you're gonna slay it. You're gonna be a Jedi master.
Seriously, yeah.
That's awesome.
Awesome.
Well, with that, thank you for another great episode, and we'll see you next time.
See you soon.